Hundreds of Howard Brown Health employees are picketing across Chicago following a round of layoffs at one of the Midwest's largest healthcare providers to the LGBTQ community.
Dozens of people are now unemployed as the new year begins. WGN's Brona Tumulty is joining us now from Uptown at the clinic at North Sheridan Avenue. Brona.
Good evening, guys. Yeah, we're told about 16% of the workforce has been laid off, with protests going strong around the city all day long. Those we've spoken with say resources were already stretched thin before these cuts. If you're driving by a Howard Brown Health Clinic or even a Brown Elephant thrift store today, you'll see sights like this. Because hundreds of people across the city, north and south,
everybody sees Howard Brown as a place where people who don't have a place to go have a space, and they're trying to take that away from our community.
Are on the front line protesting a round of layoffs, which some say they found out about through a leak at work.
They gave people a heads up because management still did not say anything to anyone.
At least 60 union and 4 non-union staff members have been let go, including Mira Flores.
These are life-saving services. People are literally going to die without some of these programs.
Lindsay Martin, who's been with the non-profit for 8 years, was also cut.
I was a behavioral health consultant, so I'm a licensed clinical therapist.
She says her team consisted of about 13 or 14 people this time last year. They were down to 7 before the layoffs. Now that number is 4.
Of course it's going to impact patient care, and it's insulting to say that it won't.
The layoffs are absolutely our last resort, and we've bargained in good faith since mid-November, and we've reached our legal requirement, which is either to an agreement or impasse. We really have not received a proposal from the union that will help us close the $12 million revenue gap.
Speaking today, Howard Brown President and CEO David Ernesto Munar says they're losing $1 million a month.
Without intervention, we'll put the agency in jeopardy and our commitment to patients. And so we're doing everything possible to turn this around.
Telling us efforts to rein in spending include a 6% pay cut for executives, but others say the numbers don't add up.
David Ernesto Munar, the CEO, gave himself a 33% raise during the height of the pandemic, and people working the front lines didn't even get hazard pay.
We took a look at some financial records for Howard Brown from 2020, which is the last full year we could find data on. They showed compensation for David Ernesto Munar at approximately $328,000. But executive compensation also accounted for just 1% of the non-profit's expenses that year. Now, for 2020, $188 million was reported in revenue by the Howard Brown Health System, but we can't see any financial records beyond the first 6 months of 2021, so it's unclear if any bonuses were awarded to anyone beyond that. Now, things have more or less wrapped up here for this evening, but the strike will continue tomorrow and Thursday. We're told all facilities within the system will still be operational throughout the course of the strike, operating under a skeleton staff. We're live on the north side. Brona Tumulty, WGN News.